Hi everybody, it's Dr. Eric Balkavage. We're back for another edition of Thyroid Thursdays. In the last couple Thyroid Thursdays, we talked about the hypothyroid patterns that exist. Traditionally, in medical practices, they typically treat primary hypothyroidism, and that's really the only pattern that's really addressed and looked at. We said there's 6 hypothyroid patterns, however, and we've talked so far about primary hypothyroidism. We've explained what that is. We've talked about the second pattern, which is hypothyroidism secondary to pituitary hypofunction. And today we're going to talk about thyroid underconversion. And so we're going to talk about what causes it, what the lab findings are, and we're going to explain a little bit in the physiology. So thyroid underconversion means that essentially what we're doing is we're not converting the T4 efficiently to T3. And that's really important because what we've talked about in the past is that it's T3 is what really gets into the cells. So if we have optimal T4 but suboptimal T3, we could still have hypothyroid symptoms and all the problems that go along with it. So T4, we said TSH triggers the thyroid gland to make 2 hormones, T4 and T3. T3 is the active form, but unfortunately only 7% of the thyroid hormone that's made by the thyroid is T3. So a very small percentage of it, if we're just relying on the thyroid gland, is actually ready to be used. The vast majority of it, 93% of it, is in the form of T4, and that needs to be converted in 3 tissues, the liver, the gut, and the peripheral tissues, into T3. And if there's anything that inhibits the conversion of T4 to T3, we are going to not make enough T3, therefore our thyroid physiology is not going to work, and we're going to be symptomatic. Your doctor may look at your lab values and say, hey, TSH is normal and T4 is normal. So if that is all that your doctor runs, they're going to miss this pattern. So TSH is going to be typically normal because we have appropriate levels of TSH stimulating the thyroid gland. It's making T4, it's making the T3. However, the conversion of process from T4 to T3 is breaking down. So if we run a more complete panel, we'll look at free T4, and the free T4 levels are adequate in this situation. Our T3 levels will be low overall because what we said is the conversion is not occurring. Free T3, the available, if T3 is low, the free T3 is probably going to be low as well. We might also have a marker called reverse T3, which could be normal, but it may be high as well. So what is reverse T3? And I think we've talked about this in other video presentations. Reverse T3 is wasted T3. So T3 gets converted into this reverse T3 and is unusable. Can't be used, can't be converted back. So we don't want to be overproducing or overconverting hormone into reverse T3. And so TSH normal, T4 normal, free T4 normal, T3 is low, free T3 is low. Our thyroid antibodies, because this is not a Hashimoto's case, are probably going to be normal, and our reverse T3 is going to be normal, could be high. If it is normal, what we need to do is we need to take a look at the T3 to reverse T3 ratio. That's something that we would do as a physician, and we want that ratio to be greater than 10. So if the T3 to reverse T3 is less than 10, we're over-converting our thyroid hormone, our T3, into reverse T3. And if our free T3 to reverse T3 ratio is less than 20, again, we're getting over-conversion into reverse T3. And that, even though the lab level may be normal, it's still an over-conversion because it's in a ratio to what the actual hormone values, the active hormone is. So these would be what our typical lab findings would look like. Causes, so increased cortisol levels, high cortisol, high stress can affect the conversion. Inflammation can affect the conversion, especially because it causes damage to cell membranes, and that's where a lot of the conversion of T4 to T3 occurs. We can have poor cellular membrane health. Zinc deficiency is critical for the conversion of T4 to T3. And so many patients that I see are zinc deficient. So that can be a factor, and selenium can also be a factor in why somebody may have low levels of T3. If they have selenium is important for the enzyme that converts T4 to T3, so if we don't have adequate levels of selenium, we can't convert T4 to T3. So that's this Thursday's Thyroid Thursday moment. We talked about the third hypothyroid pattern, thyroid underconversion. We talked about lab ranges, what we might look for in labs, and what some of the underlying causes are. All right? Hope that helps. I'll talk to you on our next Thyroid Thursday. Take care.